They tamper with medications primarily because they're trying to get a drug faster into their system. So there's a really twofold. One is to get a faster rate of entry into the brain so that they feel effects faster. And also over time, tolerance develops. So when they start taking something orally, over time they have to increase their doses, and it comes to a point where they're no longer getting that same high that they originally did when they first started using the drugs. So they use alternate forms of administration, like intranasal or injection, to get that more potent feeling, more of a high and an intense feeling that comes on quicker with a faster onset. And to tamper with those formulations, they use various different strategies, sometimes very simply crushing and solubilizing medications into water for injection, or crushing into powders for intranasal administration. So some of the formulations with deterrent features, of course, make it harder, and sometimes they use very creative ways of getting around formulations that are either have acetaminophen or unwanted ingredients, or have other mechanisms to deter abuse. So we like to make things a little more difficult for them so that it's not so easy to crush and get very high amounts of opioids into their system. It can be. A lot of the overdose that does occur will occur with high doses, particularly with injections. It can be oftentimes when folks step away from drug-taking behavior and reintroduce a drug, and then all of a sudden they have a high amount of opioid in their system, which can lead to overdose. You can overdose with oral doses. It really is a function of the amount of opioid that's taken. But oftentimes it is seen in users who have advanced to more aggressive methods of administration, like intravenous use.